All right, so the question came in, how do we know if we're a good surgical candidate? So this is a very good question, and as soon as patients come into the office, we determine with radiographic findings, or if many times they've had an MRI done. If either of these things haven't been done, then we make sure that to start that process if it's indicated. But usually we don't even pull that trigger unless we've decided, first of all, is the pain out of control, you just can't take it anymore, you're crying uncle, or two, if it's keeping you from doing what you want to do. Number three, and more rarely, but number three is also a possibility where it's very unsightly and it's causing some even psychological embarrassment as to the issue you're coming into the office to be consulted for surgery for. But once we've determined that those things are a check, one of or all three of those, then we also have to determine if physically you'd be able to handle that type of procedure and recover from that procedure. So what do I mean by that? Number one, we want to make sure that, for instance, do you have somebody that could help you, take care of you after the surgery is done? Because in podiatry, most of the types of surgeries that we do are elective. They're not something that your foot will fall off tomorrow or you're going to die tomorrow unless you have it done today. What we need to have is somebody that can help you after that. Otherwise, special accommodations would have to be made, or we wouldn't do the surgery at all. Number two is, do you have a lot of steps going into your house? That's another thing that would preclude you from being able to go up and down and putting weight or pressure on your foot. That's obviously one other thing that we need to determine is how much weight bearing would you be able to do based upon the foot surgery that we're prescribing or wanting to do. If you are non-weight bearing, for instance, and we have you on crutches or in a wheelchair or using one of those scooters where we have you put your knee on that and you roll yourself around, well, how are you going to get those up the steps? The first 3 to 4 days, at least, you need to have your foot elevated above the heart. So is your bedroom up on a top floor, or could you move your bed so that you're more on the main level and so you don't have to manage or maneuver with those stairs as much? In addition to those things, we need to make sure as well that the blood sugars are well controlled. Our patients that have diabetes, if their hemoglobin A1C is over 7.5, that needs to be managed better down into this under 7.5 range. Otherwise, they're at higher risk for an infection. There's other lab markers. For instance, if patients have to be on a blood thinner, that would definitely determine whether we need to do any kind of bridging therapy, or if we need to be off the medicine for a period of time. Our patients that have rheumatoid arthritis, if they're on steroid medications, that also would affect how we would do perioperatively any management, either before, during, or after surgery. But wouldn't necessarily preclude you or prevent you from having a surgery done. So these are several different things that are running through our minds as we are determining whether you are a good surgical candidate. And a big one as well is how you are doing mentally, as far as if you have to be down and keeping your foot elevated. Many times our patients have a difficult time being in one place to recover. Even though that's temporary, many times we recommend going back and seeing the primary care doctor and seeing if they need to be prescribed an antidepressant. But that would be something too that we need to determine if psychologically you'd be a good candidate for that as well. So I hope this was helpful, and please subscribe to our YouTube channel. We'll see you there.